Hi, this is Five Questions with an ISHLT member, and I am Jess Burke, Director of Marketing and Communications with the International Society for Heart and Lung Transplantation. And I am here today with Angela Lorts. Hi, Angie.
Hi, how are you?
I am well. Thank you for joining me today. Before we dive into our five questions, I would love it if you would share who you are, what you do, and what your role is in ISHLT.
Sure. I'm Angie Lorts, and I am a physician at Cincinnati Children's Hospital. I've been here for a long time, over 15 years. I'm a pediatric cardiac intensivist, now practicing in heart failure and VAD. My role in ISHLT has been many in the past, and now I'm a board of directors member.
Fantastic. Well, what got you involved in ISHLT to begin with? You've done so many things with the society. What got you started and what keeps you here?
So I think back to when I got involved with ISHLT. It was the first academic meeting I ever went to as a fellow, actually.
Cool.
ISHLT, it was in Washington, D.C. I remember very vividly not knowing anybody, feeling very lost, not sure where to go and what meetings to go to, but excited by everyone's own excitement about the topics and everyone being very friendly with each other. And it was just a really great meeting to be at, especially for a first meeting. And as a fellow, I think that it was a great experience.
So thinking back to when you were a fellow and when you were just getting started and all of this, what inspired your career path? What made you want to study cardiology? What made you want to get into pediatrics? What's the story?
So that's a long story. We'll make a short version of it. But I have done a lot of things in my life with medicine. So cardiology, and then ICU, and then congenital heart disease care in the cardiac ICU, basic science. And then I had a very life-changing decision from a career standpoint and went into quality improvement and heart failure ventricular assist device about 8 years after I was done with fellowship. So switched career paths and love what I do. Loved what I did before, but this is much more in line with kind of my hope to change care of kids right now. So now I do ventricular assist device care at Cincinnati Children's Heart Failure Care Transplant. And my biggest thing is running the Action Network.
Totally. And I know we'll probably end up talking about that a little bit more. So on that journey and what you're working on today, what's a meaningful milestone for you? Maybe it's in your career, or maybe it's in the field of pediatrics that you would want to share with the ISHLT community.
Sure. I kind of outlined that my career changed. That change was related to a patient, actually. I had a patient that I was very close to, a family. The mom was a nurse and is a nurse, very close to us. And he had a stroke on a VAD and very unpredictable. And it really changed how I thought about these kids. And I wanted to make it better. And so at that time, I started working with his mother to figure out how to make it better for all kids. And that was when I switched careers from ICU to heart failure VAD, and also when the Action Network started.
Yeah, that seems like a really important moment, and it's touched a lot of people since then.
Yes.
So with what you're working on personally, professionally, and when you think about the Action Network, I know so much of the work is about making things better for kids today and in the future. What do you see on the horizon for pediatric care of kids on VADs and kids with heart failure?
So when you look back, kids with heart failure haven't had any therapies that are approved for them. There's still very few therapies approved for kids. And we always use the adult therapies and the adult data and extrapolate it to kids. And we don't want to do that anymore. So I think Action and the leaders of Action, which there's 60 leaders in Action and 1,100 members now, have decided we want care for kids just like the adult heart failure patients have care. So we may use the adult medicines, but we need to get them approved for kids. Same thing with devices. And I think with devices, importantly, it's, not all kids are the same as the adults, and what device is going to fit in a child is very different than an adult. So I think on the horizon is us getting treatment to kids that's approved and studied and really understanding how it will affect them. and preventing them from needing transplant, hopefully some of them, and encouraging remodeling and recovery. And those are all the exciting parts of the next decade for kids.
Yeah, that's great. And I'm kind of squeezing in a question here, but if people who are watching this are feeling moved by what you're saying and want to get involved with Action, how can they do that? Sure.
So Action started in 2017 as 5 centers. We've now grown to 58 North American centers. And many countries have reached out and we work with them, but we have yet to really build the international presence. But we're really excited to do that as our next phase. So how to get involved? Anyone that would like to get involved with Action, there is an Action website that you can find just by Googling. There's also an Action email that has a contact in there. You can always talk to me. You can always find me on Twitter or Action on Twitter or social media. So we love everyone's involvement because that's the only way we're going to make this better.
Absolutely. So between your work in the clinic and your work with ISHLT and your work on Action, what are you doing when you're not involved with pediatrics? What's your idea of a perfect weekend?
Perfect weekend. Well, I have 2 kids, so perfect weekends usually involve them. Mm-hmm. We like to hike. They try to make me do things like backpack, which I do, but I kind of complain. So we do a lot of nature type things. We love to cook. So lots of things together. I love to read fiction books, so not too exciting, but probably people wouldn't think of me as like backpacking.
I love that. And actually, a little outdoor activity with also a little bit of complaining sounds pretty familiar to me. I like that.
Yes. But I always have to go again and go back and go for longer. So
something's working.
Yes.
And it does make me think too that perhaps there's an ISHLT book club in our future.
Yes, definitely.
Well, Angie, thank you so much for taking time to chat with me today. It's always great to talk with you and to hear about what Action is up to and what you're working on. Is there anything else you want to share with the ISHLT community that maybe we haven't covered today?
The only thing that I didn't emphasize with Action is that Action right now is pediatric sites. But we're going to learn a ton from our adult colleagues. And we've started to reach out and try to start to build those bridges. But it shouldn't be pediatrics and adults separately. We should somehow bring that together. And I think it's going to take a little while to kind of break down that barrier. But if adult colleagues are interested in Action, and as you know, we've had a lot of adult providers present webinars and be on committees, we would love to have that involvement.
That's awesome. Well, that collaboration sounds incredible. And I'll share a little information about the links to Action when I share this video with everyone. Thanks so much for taking some time today.
Of course. Thank you.